What is age-related macular degeneration?
So the macula is the center part of your retina. So this is the part of the retina that's responsible for your fine reading vision, for your color perception. And if you have a problem with your macula, you're generally going to notice distortion in your vision or reduced central vision. So there are many macular conditions. So it depends on which macular condition we're talking about. So age-related macular degeneration is largely a disease of age. So it typically happens after about the age of 50. It's very heritable in that there are certain genes that give you an increased risk. And then there are other things like poor diet, smoking, or lack of weight or blood pressure control that are weaker risk factors.
What are risk factors that lead to macular degeneration?
So the main risk factors for age-related macular degeneration are basically divided into modifiable and non-modifiable. And so we all have non-modifiable risk factors for age-related macular degeneration, the most important one being age, and the second most important ones being your genetic makeup. And so people that have macular degeneration in their families have a much higher risk of getting that macular degeneration as they get older. The other piece is that there have been good studies that show that a specific set of genes are important in causing macular degeneration. Even though you've had those genes your whole life, they don't start to cause a problem until you're usually over the age of 50. And so these genes are just part of us. Now, we can't change our genes, we can't change our age, but we can change the modifiable risk factors for macular degeneration. And so the most important ones would be your diet and smoking. And so those are very important. And then some weaker risk factors for developing advanced macular degeneration would be your cardiovascular status, meaning your blood pressure is not controlled or you have obesity. And then there are some weaker ones that include sunlight exposure.
How quickly does macular degeneration progress?
90% of people that have macular degeneration have dry macular degeneration. And so that tends to be a very slowly moving condition, and most people that have dry macular degeneration won't even notice that they have it. It doesn't cause any symptoms when it starts, when you get little waste products underneath your retina just sitting there, but the eye doctor can pick these up early, years and years usually, before you have a visual symptom. As the macular degeneration progresses, you can get little blisters that form underneath the retina, and that can cause just a little bit of subtle distortion. So it's important, if you have macular degeneration, to self-test. And so what you should do is isolate each eye independently every week or two and make sure that you're not getting new distortion or new patches of your vision that you're not seeing properly. And if you do get those things, it's important to tell your eye doctor as soon as you can. Wet macular degeneration, so that other 10% can grow really fast. And so you can lose vision over days to weeks or even hours if you get a large bleed underneath the center part of your retina. And so that, of course, should be reported immediately to your eye doctor.
What are the treatment options for macular conditions?
Well, the treatments really are dependent on the disease. And so the main treatment for wet macular degeneration would be to give intravitreal injections of anti-VEGF agents, so agents that cause the blood vessels to stop leaking and blood vessels to stop growing. Very similar treatment for diabetic retinopathy that has swelling in the back of the retina.